Dr. Subhankar Chakravorty. I'm a pediatric surgeon with Bhagirathi Neotia hospitals, which is a mother and child hospital with many pediatric super specialties. Now, a child is the most precious possession of a family, so it's always we have to give the best treatment to the child. But as we all know, children's disorders, though they are not that common, but they're very difficult to diagnose and also, of course, to treat, because you're treating the most precious possession of someone. You would need special people who would diagnose the disease, because the symptoms, they do differ from the symptoms of those of adults, and obviously the child doesn't speak and say we have such symptoms. So to diagnose and to give the best treatment, you would need a very highly trained, compassionate people who would treat the special one of yours. So there are a group of wonderful people called pediatric surgeons who are not just surgeons, but they actually are the designer of your child's future. And more you do that, you especially start designing a society's future. Because treating a child today with compassion, the way you treat that child would basically translate into how that child would become a part of the society. The outlook that he would have towards modern medicine, the outlook he would have towards the doctors, and obviously for the parents. So treatment for a pediatric surgical child is very important, because you must know that you're not dealing with an anatomy or a structure, but more for function. For example, congenital problems like a child who does not have an anus opening, there's no anal opening in that child. You would have to create an anus, but also to make sure that the child can hold the stool until he reaches an appropriate place. Otherwise, the surgery would make no sense. You would have to make that child continent. For a child who is born without a food pipe, the esophagus, you have to make sure that the child for the rest of his life can swallow the food properly and would have no problem in this normal way of life. So this encompasses a lot of understanding of the physiology, understanding of the growth, what the child would become when he grows up, to forecast what is going to happen. So you are more like designer of the child's future. And obviously, as far as the surgical compliance is concerned, you have to be very, very, very good, because you are not only dealing with the most precious thing, of course, of a family, but also you're dealing with very delicate organs, very small, very softest of the soft tissues, which can bleed, which can get tear very easily. So you have to be very delicate. So not only being a good surgeon, not only being a good clinician for diagnosis, not only being a compassionate doctor, but also you have to be a very good surgeon. You have to do the thing very properly. You have to be a good designer, a forward thinker, a person who could forecast, look into the child's future, and make some good decisions for him, make the right decisions for him. So with great privileges comes great responsibilities. We are privileged, like being pediatric surgeons, we get to treat your child, the most precious thing in your family. So we have some responsibilities that comes with it, needless to say. And that responsibility is to make you aware. This video targets to this fact that you must know that if your child has a pediatric surgical problem, you must take him to a pediatric surgeon, because it's more than just diagnosing and treating the disease. It's actually looking into the future, the child's future, that you are actually plan the surgery, decide the surgery, and give the most optimum outcome, the most beneficial outcome, so that your child has a good functional future. So that's what we look upon. And this responsibility goes to every nook and corner of our specialty. Everyone in our specialty has got this thing in the back of their mind, that he is a designer of the future. So that's it. I would like to say, seek help from a good pediatrician, from a good pediatric surgeon, and obviously in a wonderfully located, wonderfully placed hospital that's so well equipped to deal with surgical emergencies of children, because you have to have a wonderful pediatric intensive care setup for newborn surgeries with congenitals who have lot of compromised system. You have to have a good neonatal intensive care. Bhagirathi Neotia is a hospital which provides state-of-the-art technology as far as their intensive cares are concerned. The wards are well equipped. They have got wonderful caregivers who are very well oriented about a child's need. With that, I would like to conclude. Thank you for your patient hearing, and God bless your precious one.